Today, the topic is all about depression, which is very common in this era. So, let's begin this topic and we'll understand that what are the causes, risk factors, and also what things need to be done in terms of yoga therapy. So, let's begin it. Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest, and also called major depressive disorder or clinical depression. It affects how you feel, think, and behave, and can lead to a variety of emotional and physical problems. You may have trouble doing normal day to day activities, and sometimes you may feel as if the life is not worth living. More than just a bout of the blues, depression is not a weakness, and you cannot simply snap out of it. Depression may require long term treatment, but don't get discouraged. Most people with depression feel better with medication, psychotherapy, or with the both. So, what are the symptoms of depression? Although depression may occur only once during your life, so people typically have multiple episodes during these episodes. So symptoms occur most of the day and also nearly every day and may include feeling of sadness, feeling of tiredness, feeling of tearfulness, emptiness or hopelessness. Along with that, I must say that angry outbursts, sometimes they feel irritability, frustration, or over the small matters. And also along with that, loss of interest or pleasure in most or the normal activities, such as the hobbies, you're deciding the sports. Sleep disturbances include insomnia or sleeping too much, because when the people are in depression, they are the lack of energy. They want to do the work, but they couldn't. Okay, so tiredness, lack of energy. So even a small task take an extra effort to reduce the appetite, weight loss, or increased the craving for food, and the weight gain may happen. Anxiety, agitation, or restlessness, slowed thinking, speaking, or body movements, etc. Along with that, feelings of worthlessness or guilt, fixating on past failures or self blame. This is what is happening in terms of depression. Trouble thinking, concentrating, making decisions, and remembering things. Frequent or recurrent thoughts of death, suicidal thoughts, and also suicide attempts. They have might in their mind, okay, no, I have to just to cut off my life, or suicide unexplained physical problems such as back pain, headaches, because their body become too stiff sometimes. For many people with depression, symptoms usually are severe enough to cause some noticeable problems in day-to-day activities such as work, school, social activities, or even in the relationships with their friends, with their partners, or with their parents. Some people may feel generally miserable or unhappy without really knowing why. Depression symptoms in children and teens. So, in younger children, symptoms of depression may include sadness, irritability, clinginess, worry, aches, pain, refusing to go to school. Sometimes, what happens if might be the person, the children get bullied, so person may get the depressive thoughts. So underweight they become. In teen, symptoms may include sadness, irritability, feeling negative, and worthlessness. Anger, poor performance, or attendance at school should very poor. Feeling misunderstood and extremely sensitive, using recreational drugs and alcohol, eating and sleeping too much, self-harm, loss of interest, along with in daily activities like going to the park and avoidance of social interaction. It may happen. So the depression symptoms in older adults. Symptoms of depression may be different or less obvious in the older adults. First of all, in the person, those who are in the depression, they does not want to interact with the people. Okay, so dissociation may happen in the older adults. memory difficulties or personality changes, physical aches or pain, fatigue, loss of appetite, sleep problems, interest, loss of interest in having the intimation with the partner, and not caused by a medical condition or medication. Often wanting to stay at home rather than going to socialize or doing the things. Suicidal thinking or feelings, especially in the older man. So, what kind of things should be necessary in terms of yoga therapy? So, I would suggest that the people, those who are facing, they will do the practices such as upward facing dog pose, downward facing dog pose, forward bending, child pose, etc. And also, I will definitely recommend to do the activities those who indulge the body in a fastest way. For example, Surya Namaskar they can practice, or they can practice Sthul Vyayam. In the Sthul Vyayam, there is engine dod, etc. A lot of things which included the running and also in a faster way. So that person did not want to stay on that thought right now. So in the practice, they will indulge more in the body rather than in the thoughts. So like breath work, meditative thoughts, etc., meditation, visualization, you should reduce and indulge more number of physical practices in terms those the person who are dealing with depression. So this is all about the yoga therapy module that the person may can get. And also do not eat any type of the food which is in more amount of fat, because it will indulge the laziness. Included the things like carbs, protein in a proper amount, vitamins especially you should take more and more, fruits you should eat, the seasonable fruits. Okay, so this kind of normal diet you can take in less number of fried fruits, chocolates, reduced it, those the person who are in the depression. So this is all about the psychological and the psychiatric disorder depression. Thank you so much for joining this session.